Hey folks, Dr. Dan here with DocTalk. Sure glad you joined me today. We're going to talk about injection sites in beef cattle. It's a huge issue, something that we do every day, something we take for granted. Let's talk a little bit about it and let's move on down the road. Thanks for joining us, and more after these messages.
Closed captioning brought to you by Kansas Soybean Commission. The Soybean Checkoff, Progress, powered by Kansas farmers.
This segment brought to you by Kansas Regenerative Medicine. Your stem cells, your health, your life.
Hey there folks, Dr. Dan from DocTalk. Thanks for joining me here from the College of Veterinary Medicine at Kansas State University, and we're talking about injection sites. And really when I break it down, I start to think about injection sites. There are many different topics that come to mind. So today what we're going to talk about is choosing the proper equipment, making sure that we use the proper sites on the, as far as anatomically on the cattle. We're also going to talk about proper injection techniques, and then we're going to talk about remote injection techniques that are being used more and more out in the field. When we start to think about using the proper equipment, the first thing that I start to pick out is the proper needle. And depending on what type of injection that we're going to do, we'll have different needle sizes, and depending on the viscosity or the size of the animal that we're giving the injection to, we'll have different gauge sizes. So as we move down the number in gauges, the bore of the needle gets bigger. And so most of the needles that we're going to use in beef cattle production are going to be 16 and 18 gauge needles. It's going to come in the silver and the green caps. Sometimes we'll use 14 gauge when we're giving intravenous injections to cattle, but for the most part for sub-Q and IM, we're going to use 16 and 18 gauge. Now the length of the needle starts to change depending on the type of injection that you're giving. If you're giving a subcutaneous injection, which is between the skin and in front of the muscle, so in that space between the skin and the actual muscle tissue in the neck, that's a subcutaneous. And that we're going to use a shorter needle. I like to pick out a 5/8 to 1/2 inch needle, 16 or 18 gauge. If you're going to do an intermuscular injection, which we want to bury in the muscle, which when I get my flu shot, it's an IM injection, we're going to use a 1 inch to 1.5 inch length needle. In that, usually we're going to use the 18 gauge rather than the 16 gauge for a lot of our IM injections. Most products today are sub-Q, but if we do go IM, we want to make sure that we use that type of needle. When we talk about vaccine and proper vaccine storage, whenever you're giving injections, remember this. The bottle of vaccine is very sensitive to the ambient temperature. So on a hot day, we want to make sure that if we're not drawing out of the bottle, we want to make sure the bottle's in a cooler where it's cool, and also in a place that's dark, because ultraviolet light can kill the modified live vaccine. So when we're looking at proper equipment, not only do we need to think about the needles, but we need to have coolers that we can keep temperature and UV light away from the products that we're using so that they don't become denatured. Today, syringes, most people are using plastic monoject syringes. We used to use the stainless steel and glass syringes a lot that were not disposable, but now they're priced at a point in time where most people are going to use those. Use the smallest one that you can to handle the load of the vaccine or the product to deliver that, because it's easier to handle in your hand and it's cheaper to buy. We're going to take a break now, and when we come back, we're going to talk about the proper injection site map on the steer or heifer. You're watching DocTalk. We're glad that you joined us. Come back and see us here after these messages.
Next time you see a beautiful field of corn, reach out and thank the farmers who work tirelessly to raise corn for livestock feed, renewable fuels, and exports to feed a growing world population. The farmers on the Kansas Corn Commission work for Kansas Corn with grower-funded checkoff dollars that support foreign and domestic market development, research, promotion, and education to expand opportunities for Kansas farmers. To learn more, visit kscorn.com. Buying a car shouldn't be this hard. And at Brown Chevrolet Buick in Wamego, it isn't. It's actually awesome. Whether you want a new or used car or truck, Toby's team can make the deal. Even if you want to custom order a new car or truck, Toby's team can make the deal. See Toby's team at Brown Chevrolet Buick in Wamego. We're awesome.
To see this show and past episodes of Ag AM in Kansas, go online to agaminkansas.com. DocTalk, brought to you by Santa Fe Trail Meats in Overbrook, or visit us online at sftmeats.com.
Hey folks, Dr. Dan from DocTalk. Thanks for joining us here on the show today. We're talking about something that we do every day, and that's giving injections to cattle. And you know, the one thing that the Beef Quality Assurance Program has done is it's done a great job of moving the injection site from where we have edible product to a place where we have decreased amount of carcass value loss based on our injection sites. It's amazing to me that improper injections, even given to baby calves at the time of branding, can wind up causing injection sites and trim losses on fat cattle when they go to the plant. And so when we think about that, the industry needs to be commended for providing the proper education on where to give injections to, but also we have to give some compliments to our pharmaceutical and biological companies who took the notice that intermuscular injections given in larger volumes are also things that cause us some issues with injection site lesions and lost product, and in the end decrease the profitability of us in the beef industry. So it's been a long time coming. It's been a big team project with many people having many different roles to get us there. So anatomically, when we start to look at pictures such as the one that we have up here, looking at where we're going to position our injections, we're going to position the injections in the neck region, and there's a triangle region on the neck that goes with three borders. The three borders of the injection site triangle, the dorsal border or the top border is the nuchal ligament. This is the ligament that's about as big as a rope that goes from the pole of the head to the withers of the calf and helps the calf with the head up and down type movements. The next boundary for injection site triangle is the point of the shoulder. And a lot of times in the restaurant and in the packing industry today, we're taking that muscle on the point of the shoulder and using that as a whole muscle cut and being able to sell that as a roast or as a whole muscle into a roast or steak type product. So making sure that we're in front of that is vitally important. And the last landmark is the vertebral column. The vertebral column runs right down the middle of the neck. So between the middle of the neck to the point of the shoulder and the top boundary being that nuchal ligament, as we have outlined here in this picture, gives you an idea of exactly where those injections should go. Now, when we give an injection, the injection, we're going to talk more about the techniques. But the big thing is, if you're given an antibiotic that's over 10 cc's, we need to only give 10 cc's of a product per injection site. And I always say that from when we move from one injection site to another within that triangle, we want to be a hand's width or 3 to 4 inches apart as we move from point to point in that process to give multiple injections. It's one of those things that I know we harp on it with beef quality assurance. We visit with producers multiple times, but understanding where those landmarks are, understanding why we give the injection sites at the places that we do, are vitally important. Thanks for watching Doc Talk. When we come back, our next segment is going to be about what are the proper injection techniques. Stay tuned, more to come.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Ashley Zondlak grew up working on her neighbor's dairy operation, and at 16, it became her full-time job. Over the years, she has shown cattle at local fairs, volunteered at Breakfast on the Farm events, and during vet school, she worked in Michigan State University's mastitis lab. After graduation, Ashley's goal is to work as a food animal practitioner. Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net.
The Kansas Wheat Innovation Center in Manhattan is rediscovering ways to get improved varieties and new genetics in the hands of farmers faster. Grower-led and checkoff-funded research initiatives are bringing about positive change. This grassroots leadership provides a strong voice in Topeka and Washington, D.C. Now is the time to partner with Kansas Wheat in moving wheat forward. Kansas Wheat Commission and Kansas Association of Wheat Growers. Farmers investing in their future and yours. Log on to rediscoverwheat.org.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Soil is the life of a farm, and for 25 years, SureCrop Liquid Crop Nutrition has helped growers produce abundant quality crops while preserving and improving the soils they steward. SureCrop offers complete soil and plant analysis with cropping recommendations, delivery direct to your on-farm storage, and quality crop nutrition custom blended for your field. Choose SureCrop for the assurance of excellence for your soil. Call today or visit their website for more information.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
To see this show and past episodes of Ag AM in Kansas, go online to agaminkansas.com. DocTalk, brought to you by
The Kansas Soybean Commission. The Soybean Checkoff, progress powered by Kansas farmers.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here from Kansas State University. Sure glad you joined us today talking about injection sites. And the injection sites are something that you and I do every day to cattle, but sometimes we take it for granted and we might get a little sloppy with our technique. And you know, you always want to make sure that you use clean needles, and you want to make sure you never put a dirty needle into a bottle. So if you're going to draw up, use some sort of needle for drawing up and the other one for injecting. And in between cattle, make sure that you get any kind of manure or solid material off of that needle. We talked a little bit about the injection site and the injection site triangle. One thing I failed to mention is that if you are branding calves and you have the calves stretched out and you're positioned on top of that calf where it makes it dangerous to inject yourself in the injection site triangle, the BQA approved alternative site for vaccinating calves subcutaneously when we're stretching them at branding is the dewlap there at the right underneath the neck and right in front of the thoracic inlet, or right in front of the lower leg. So another place that you can give that injection. When we give a subcutaneous injection, as I mentioned earlier, it's an injection that goes between the hide and the muscle. We want to put it in that subcutaneous space. So when we give that injection, as you can see in this picture, we're giving that at a 45-degree angle when we come in with the syringe. We used to tint the skin, call it the two-hand technique, where we would stick a hand in, pull the skin back, and then give the injection behind where we have the tinted skin. Today, with workman's comp, people sticking themselves with needle, the recent survey showed that 80% of people who vaccinate cattle or work on beef ranches have injected themselves or stuck themselves with a needle at some time. What we need to do to protect ourselves is go in at a 45-degree angle, make sure that we have the needles positioned within the sub-Q area. It's very easy. Use the proper needle size, 5/8 to 1/2 inch, and inject the product. If you're going to do an IM injection, we already mentioned that you're going to use a longer needle. We'll use the same injection site triangle to give that injection, but the difference is that you're going to go in perpendicular to the animal's hide. And so we're going to pass through the hide, through the sub-Q area, into the muscle, and deposit the product. Very few products are labeled IM. Nearly all products we used are labeled sub-Q. Two alternative products, when we use the Exceed product that goes behind the ear, at the base of the ear, that product needs to make sure you have the 45-degree beveled needle so that you do not inadvertently put that product into the artery, which could be very detrimental to the health of the calf if it would wind up at the brain and actually kill the calf. The other product is Flunix and Meglumine or Banamine. We need to make sure that we give that intravenously in the jugular vein, because that product can be very necrotizing to the muscle and to that surrounding area where the injection is given if it's not given in an IV manner. Intravenous products given in the jugular, we're going to stretch that calf. The biggest thing is this. With IV is to make sure that you have the head of the animal restrained. You have the head of the animal restrained, then you can seal off that jugular vein, have that pop out, and you can give that IV injection. Be sure to work with your veterinarian. They'll be happy to teach you how to give an IV injection to make sure that you're delivering these products adequately. When we come back, we're going to talk about the remote delivery systems. You're watching DocTalk. Thanks for joining us.
The BQA tip of the day, sponsored by Beringer Engelheim Vetmedica Inc.
I'm Dr. Nels Lindberg with Animal Medical Center and Production Animal Consultation. Today's tip, we're going to talk about accurate dosing of cattle as we process or work our cows and calves. It's very important that we dose them accurately. How many times do you set your automatic dosing gun for your wormer? Just set it on a flat 60 and process your cows. I would suggest or recognize that we actually ought to take a more accurate approach with the weight and dose it up and down accordingly. We could be overdosing, we could be underdosing. Underdosing, as we know, leads to resistance. Overdosing reduces efficiency. So the most accurate way is to bring them in the chute, have a scale head, collect a weight, and dose them accordingly. If you don't have a scale head, I would suggest that you could get one. I promise you it will pay for itself over time.
Hello, I'm Dr. Frank Lyons from Kansas Regenerative Medicine Center here in Manhattan, Kansas. Daryl was one of our patients that we did about 7 months ago.
I dug trees by hand for years and years and years. In the process, I wore out my rotator cuff. But when I learned about this process, I thought if there's a way to get rid of this pain, then I want to do it. So we did it and it worked. And I'm not going to go out and dig trees with a shovel anymore, but I can do the things that I want to do now.
Well, it's been very gratifying to help people with their painful joints and other entities. And it's been especially gratifying to be able to help people who I know and have worked with and known for many years.
Here's another gardening tip with Annette Jackson from Jackson's Greenhouse.
Fall is a great time to plant perennials, trees, shrubs, and bulbs. Root development occurs with the moist and cool soil conditions, which means better growth next year with less watering and maintenance. The use of mulch on all plantings helps protect from freezing, thawing, and drying out. Let Jackson's help with your next plant.
Jackson's top quality fall bulbs for spring blooming have arrived. Always plant the best bulbs for bigger, better blooms.
Jackson's Greenhouse has what you need today.
Heinen Brothers, a fourth-generation Northeast Kansas farm family, knows how tough farming can be. Farmers helping farmers. Heinen Brothers Ag, selling and servicing crop protection products, fertilizer, anhydrous ammonia, cover crops, quality aerial and ground application. Call today to learn about our extended term financing program, 800-760-4964. HeinenBrothersAg.com.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
Kansas Farm Bureau, the voice of agriculture, represents grassroots agriculture. The state's largest and most powerful farm organization stands up for its members through leadership development, agriculture education, legal defense, environmental advocacy, farm safety, and risk management. Members also enjoy money-saving benefits. To join our organization today or to learn more, go to www.kfb.org or find us on Facebook and Twitter.
Tallgrass Commodities offers producers bulk commodities at a reasonable price with reliable service throughout the whole Midwest. To find out more about Tallgrass Commodities,